I'm now pleased to introduce you to Dr. Linna Lee, who is our new Medical Officer of Health. I think she's been on the job for almost 3 months. Almost 3 months. And Dr. Paula Stewart, who was her predecessor, was very, very supportive of the work that we are doing in upstream prevention as part of Planet Youth Lanark County. And I'm absolutely delighted to be able to report that Dr. Lee is doing exactly the same. So we're very happy to have you here and look forward to hearing you. Thank you.
I'm going to very conspicuously move the microphone down to my level. So hi everyone, my name is Linna. There's lots of you guys whom I haven't met. I'm new to this. Oh, I moved it down too far. So I was saying, hi everyone, my name is Linna. There's a lot of people here who I haven't met and some familiar faces I'm happy to see. My time here has been just under 3 months. I'm living in Brockville now, and I'm just so pleased to be here. For me, being part of this community event is really exciting because the work of Planet Youth, the work of preventing substance use and abuse in youth is such a core part of the public health work that we do at the health unit as well. The WHO defines health as a state of complete physical, mental, and social well-being. Sometimes it feels like that sort of phrasing is really up in the air. It's hard to tell what to do about it down in our day-to-day lives. And to me, it means health that all of us can have is something that's upstream, the stuff that happens before we get sick, and stuff that helps us know that we're living well and enjoying our lives. And so for teens in particular who are exploring their independence and getting to know what the world is like on their own terms, health is something that's really critical to understand and to pay attention to. Maybe they're not thinking about that, but certainly from the healthiness perspective, we're really thinking about that. And for teenagers, what does a complete state or a state of complete physical, mental, and social well-being mean, really? From a public health perspective, and I think for many of us in the community, what it means is having a safe and nurturing family, significant friendships, supportive and vibrant people surrounding them, day-to-day activities that provide a sense of fulfillment and self-worth, confidence, and a positive view on their life and their future. It means enough sleep, it means not being bullied, and it also means, to the point that we've been talking about today, it means having really just that limited or no exposure to substances, such as cigarettes, cannabis, and I'll include also alcohol. And I know that in a lot of our communities, certainly I can think of my youth, alcohol is not considered so much of a risk or a potential damage to people's health. And I really want to emphasize that alcohol is a part of what we consider risky substances for youth, as well as for adults. So all these things I think are critical for teens, because being healthy at that age really sets people up for being healthy later on in their lives as well. And we know that substance use is something that affects the developing brain, and that people's brains develop in their teens really quite dramatically and also well into their 20s. And research also indicates that teens who start using substances at a young age are more likely to have unhealthy relationships with substances later on in their lives. And so the habits that we get into and lessons that we learn as teenagers can really stick with us in the long term. And I'm sure many of us in this room can think of situations where that applies to us ourselves as well. And so Planet Youth is based on a program with really robust evidence, international evidence, of being effective in reducing and preventing youth substance use. This is a program that does it by enhancing health holistically among youth. So it's really not just about substances, it's about health. And that's why I wanted to start my comments really looking at the really, really big picture, not just about substances, but about health in general for youth in our communities. And so this is also why data collected through Planet Youth is asking about so much more than specifically substances alone. It really looks at other parts of teenagers' lives that affects their substance use, but it also affects many other parts of their lives. It gets at the underlying things that affect health really for all of us. And really, that's what we mean by working upstream. That's really what we mean by health promotion. And so when we think of Planet Youth, one of the strengths for us in this community is that we have local data. We have the information that many communities could only dream of, which is we've asked our youth directly, and they've given us the information that they have. And so using this Planet Youth program, this data is really part of a cycle where we can ask the data repeatedly over time and track how well are we doing, and how are the youth doing in our communities, not just for substance use, but in many, many other domains of their lives. And so for me, this is such an important part of, again, that health promotion among youth. And it's so exciting because it's local, it's led by the community, and it's really a privilege for us to be part of as the health unit. And so really, I think for me to be coming in, halfway or well into the program, I really can't say anything other than congratulations to everyone. It's so exciting for me to be able to join this and take part, and I'm looking forward to where we go next.